Hello everybody, we welcome you to another episode of Talks with Trust. I'm Dr. P.V. Nishant, Consultant International Cardiologist, Trust Hospital. So recently, during the Times No Business Awards, Trust Hospital was selected as the best multi-speciality hospital. So with this in mind, Ivala we are actually Talks with Trust. Sadharananga we do scientific sessions. Today, Ivala we are doing a session with our managing director, Dr. Kalyan Chakravarti. ఈ సెషన్ 2 parts చేస్తున్నామండి. ఫస్ట్ పార్ట్ విల్ బి అబౌట్ ట్రస్ట్ హాస్పిటల్, సెకండ్ పార్ట్ విల్ బి అబౌట్ సర్టన్ ఇష్యూస్ విచ్ మోస్ట్ హాస్పిటల్స్ ఫేస్ దీస్ డేస్. వాటి గురించి కొంచెం సార్తో అడ్రస్ చేస్తాం. ఇక్కడ పర్పస్ బిహైండ్ దిస్ ఇంటర్వ్యూస్ టూ ఫోల్డ్. వన్, అసలు ట్రస్ట్ హాస్పిటల్ ఏంటి, ట్రస్ట్ హాస్పిటల్ విజన్ ఏంటి, ఇది ఎలా ఎస్టాబ్లిష్ చేసాం, ఎలా ముందుకు తీసుకువెళ్ళామన్న విషయం చెప్పడం ఒకటైతే, హాస్పిటల్స్ రన్ చేస్తుంటే వచ్చే ఇష్యూస్ వాటిని సర్వసాధారణంగా ట్యాకిల్ చేసిన విధానంలో ఎలా మేము అడాప్ట్ అవుతున్నాం, మా నుంచి ఎవరైనా ఇన్స్పిరేషన్ పొందినా లేకపోతే ఆ విధంగా వాళ్ళ హాస్పిటల్స్ వాళ్ళు డిజైన్ చేసుకున్నా మేము చాలా హ్యాపీగా ఫీల్ అవుతాం. సో వీ వెల్కమ్ డాక్టర్ కళ్యాణ్ చక్రవర్తి గారు, మేనేజింగ్ డైరెక్టర్ ట్రస్ట్ హాస్పిటల్. ఈజ్ ఆల్సో an anesthetist and critical care. Sir, first of all, we have to let people know how trust was conceptualized and what was the starting point behind trust.
Good afternoon, everyone. Thank you for the invitation, Dr. Nishant. And I've been wanting to do this for quite some time, for quite a few years, in fact. The same kind of discussion. Anyway, thank you for taking up this. In the first place, Trust Hospital was never in our minds. We were all a group of doctors, most of us were a group of doctors working in another hospital, and just because there were some administrative issues that we had with the administrators there, over a cup of coffee we decided to start a hospital. And it was only just 2 or 3 of us that discussed about this, and then when we gave it to the others, there was a ready acceptance. And so yes, Trust was born over a cup of coffee. I'll be happy to say that. So enjoying my coffee every day, I think this is what brought Trust today. So Trust Hospital was started in the year 2010 as a firm, and then later on we converted to a private limited company. This was started by a group of doctors, all of us who were working in another hospital and decided to come out and start another hospital. Until we came out, we never knew the administrative issues that really rattle people around. And once we got to do this, that is when we decided administration is not an easy thing. And yes, this exactly made us act even more wiser and then be tough at some times in running this hospital. Yes, but then Trust Hospital is a result of all the doctors who work here, and then today we stand here because of everybody who has worked in this hospital today to this date.
Most of the hospitals now are actually run by business companies, and probably we are one of the last, I wouldn't say last time, one of the few hospitals which are still actually run by doctors, completely run by doctors. So how have you managed to integrate? See, because different doctors, as you rightly said, none of us were administrators. We were all doctors actually practicing. So how did you actually manage to integrate all of these doctors, all of the knowledge in medical profession, as well as their experience as people and different kind of personalities? How did you integrate them to be able to run this hospital for this long without actually having
studied? Yeah, the other thing is the concept of Trust Hospital itself is every doctor who works in the hospital is either a partner or a shareholder, whatever, but he has a stake in the hospital. So that is the reason why the hospital still keeps running good. And we never managed to integrate all these doctors together. But then yes, when you have so many people working together in one place, it is always difficult to bring everybody on the same line. But then at the same time, there will be different personalities. It is up to the administration to cater to the different needs of different personalities and then adapt to that situation. Flexibility is the name of the game. everybody will have to be flexible and adapt to one another, and then adapt to situations that might be thrown up against you, because every day in a hospital setting you will get new challenges. So flexibility and adaptability are two important things that we have to adapt. We have to imbibe in ourselves to keep the organization running. And then also, it is also important to take these different personalities along, because everybody will have a negative about him or a positive about him. It is not our problem to take up the negatives, it is our problem to take up the positives, which actually might help in the organization growing. And yes, everybody will definitely be an asset to the hospital, to any organization for that matter, not only to this hospital. So it is the positives that you pick out in an individual that is more important than you always try and pick up the negatives in an individual. As leaders, we need to be leading by example, which is more important. So as I do, my juniors do, and as my juniors do, as the junior consultants do, the staff does, and it depends, it percolates down the ladder. So it is how we behave at the top that goes down to the bottom. And then also what we have done differently in Trust Hospital, I would say, is we have given roles to every doctor, every consultant, every shareholder, whatever. They have been assigned roles. They have been given responsibilities and authorities as well in the hospital. So it is not that they are not listened to, that they are not heard to. Every suggestions that they give is heard, and then every opinions are also taken, so that there might be something good coming out of opinions and solutions. So that has been our bottom line, and that is how we have worked all these years. Basically, a good administrator needs to have a good year. That is what we've been doing all these years. And as an anesthesiologist, I learned very soon after we started the hospital that I need to do some kind of an administration course, and that is when I did my MBA in hospital and healthcare administration, and that is what taught me a lot of things that an administrator actually needs to do. So until then, we did not even know why our administrator in the previous hospital was sometimes acting strange with us. Yes, we do have to act strange sometimes as administrators.
One of the things after the doctors for any hospital to run will be the nursing staff and the paramedical staff, which are very, very important. And you as a group, with you, some paramedical staff have come out. And over the last 10 years, I have been with the organization. I have seen that the senior cadre of the paramedical staff who have come with us have managed to stick on to us, to everything. So what is it that makes, this is a question for people in general, anybody who's running a hospital in general. What is it that makes your staff loyal to you? Is it the financial commitment you give them, or is it something else? On how have you managed to kind of retain your best staff members? I'm not talking about doctors. I'm talking medical and paramedical staff.
Yeah, basically, like I told you, until I did my MBA, I never even knew what human resources management was. Once I did my MBA, that is when I realized how important human resources management was. That is actually what taught me how to go about with my staff on a day-to-day basis, on a yearly basis, when their increments or their bonuses time comes up. So that is when you need to talk to a lot of them, you need to cajole them, you need to be friends with them at times, and then you need to be strict with them at times. So it is how you hold them close to you is more important. They need to be cared for. That is what we have given them. We have always cared for their needs, be it their personal needs or be it their professional needs. But their needs have been met, even though not completely, but then they have been addressed at least as a moral support. So that is actually what keeps our staff together. But there will always be some people for whom finances are important. I wouldn't say finances are not important, but then every organization has its own limitations. So similarly, we also have our own limitations in the finances. So we go according to the needs. So that's how we've been able to hold two people together.
in this kind of journey from a small to a small hospital, we used to be in the small building to a seven-story building, probably one of the largest in Kakinada. 13-year journey, you must have had some milestones and you must have had some setbacks. So, what were your major milestones and what were your major setbacks? And people actually learn more from setbacks rather from milestones. So, I would actually like you to kind of focus on that.
Yeah, I mean, when we started this hospital, we started off in a rental building, which was a 30-year-old building. And many corporates, when we approached them, would say that they never liked the ambience of the building. In the first place, when I started my practice about 30 years ago, and when we were treating patients in the critical care units, and then they would, like on day 2 or day 3 after stabilization, they would say we are going to Hyderabad or Chennai or places like that. That is what actually pinched me, because we were doing all the initial dirty work, I wouldn't say, but then initial stress we would take and in stabilizing the patient, and then they would go to higher center. So it has always been my dream to see that Kakinada would become a one-stop healthcare solution for people of this district at least. So that's been there in my mind always. And luckily for me, friends came along and we all got together, we all gelled together, and then we had a common goal, and we worked towards this common goal of making Trust Hospital a one-stop healthcare solution for people of this district. So achievements would come as a byproduct to all the hard work that you put in, and then more than the achievements, it's the setbacks that actually kept us going through. So I wouldn't say achievements, but then setbacks are the most important things that we did have. But I'm not going to name any setback because negatives, no point in propagating negatives. But then at the same time, having our own building, our own hospital of this size with this kind of an infrastructure, which is one of its kind in the state, and the way we work is also a model kind of a thing for the state of Andhra Pradesh, because I don't think there's any other hospital which works in these lines. We've been asked many number of times, how do you people get along? How do you people get along with, let's say, 20, 25 doctors, and how do you all get along? It's very simple. We all get along because we just listen to each other, we care for each other, and that's how we go together.
One of the things, Ravi, which plagues corporate healthcare right now is the mistrust with the patients. After the staff and the doctors, the next kind of kind of entity that we meet on day-to-day basis is the patients. So violence against doctors and kind of mistrust with the general kind of corporate sector in general. So two things: how have we managed to tackle that, and what advice would you give for anybody in corporate management with regards to this? Like overall, as a doctor, I would like to see a society where there is no violence against doctors at all. That's probably it's a kind of utopian dream, but it's something we should probably work towards. And what would you suggest?
Yeah, mistrust and violence against healthcare professionals is a social problem, and these social problems will have to be addressed not just like that, but then one is by way of public awareness and then public education about healthcare and the stress that healthcare professionals undergo. So, as long as you don't tell the public about the stress that healthcare and healthcare professionals undergo, then they will never know what it takes to be running a hospital. The other thing is winning their confidence. It is basically by winning their confidence. I mean to say, it is their communication that gets their confidence. That gives them the confidence that the doctor is particularly treating well, and that the hospital is treating their patient adeptly. So yes, communication is very important, and then we need to have more stringent laws because there are certain raw elements out there who are always looking for some kind of small issue so that they can pick up a problem. and then make a huge issue out of it. So there needs to be some stringent laws which should make the public also punishable in case they do something wrong. So it is there, but then the implementation is not there from the administrative side, from the government administration. Yes, I think it's pretty much the public and healthcare put together can actually bring down the violence against doctors and hospitals. So it's, and yes, the other thing is community has to be involved. There can be stray incidents, and when you involve community in it, community will also help in suppressing these kind of violence against hospitals and doctors.
One of the things that actually endear any hospital to the public is a kind of public health work or public health work that you take up, and public health work that you do. That's like over and above the routine hospital. So, with regards to trust, can you just kind of let people know what we are doing as far as the public health is concerned, and the awareness programs which we do, and the walk and the talks which we do? Can you just tell them a little bit about that? How we are participating to make the community healthier at large? We are not going to be ivory towers of disease, as the old saying goes. How to prevent that?
Yeah, I mean, like I told you, public education is very important. Public health education is important, and public awareness, creating awareness is also important. So when you take up all these three things, you will actually help preventing diseases or preventing or else stop chronic disease from escalating further. So uh, as a hospital, we've taken up this in our stride. In fact, we have adopted a couple of villages, so where we run health checks for them on a regular basis, and then we also wanted to adopt the village in the surrounding of this hospital, but then it is yet to happen. So once you do this kind of things, you get the community's confidence, and then you will also be able to address health issues in the community. Thereby, they know what to do and what not to do. And then apart from that, when there are special days like a heart day or a kidney day, we kind of rally around in the public and then try and create awareness. But I'm not a big fan of advertisements and stuff like that, but then that seems to be the industry now. Anyway, but for me, it is the mouth-to-mouth publicity that is more important. So similarly, our public awareness campaigns are also run on the same basis, that our doctors go meet small communities, address the community, give them kind of health tips, and so when you are talking to small groups, you actually reach better. So our concept is that target a small audience so that the audience gets you completely.
What is the future vision of the Trust Hospital? What is the innovation, the expansion? And one more thing which I would like to address when you're answering that is, any small group of doctors out there who are actually trying to kind of get their own premises and want to start their own setup, how would you advise them?
I may be wrong, but then I think individual practices are probably the days are numbered, and then it is the group practice that is probably going to has come to stay in. If you are going to, if you really want to start a hospital, I would say get your friends together, form a small group, and then form a hospital, so that you will be able to deliver number of services under one roof, rather than asking your patient to shuttle between point A, B, C, D, etc. So that would be my advice to anybody who would actually want to start a hospital. Then what is the
Vision of our hospital.
Yes, Trust Hospital. Yeah, for us, the vision is like it's a dynamic thing for us. Any day, we would like to be update in healthcare society, in healthcare infrastructure. So whatever is needed for the consultant, and there is a need for that in the community in this place. Yes, we would definitely equip ourselves with that, and then so that we will be able to deliver proper, good healthcare to our patients. I think we would like to stand out as one hospital that delivers complete healthcare solutions, at least in these parts of the district. And then we would also like to spread our wings to the neighboring places. I won't say neighboring districts, but at least to the neighboring places, so that we can cater to more number of individuals.
So, thank you, sir.
Thank
so,
you.
Thank you, friends. That brings to the end of this interview. Any questions you want to be addressed, as I told previously, you can put it in the chat box. We'll try to address them. So, we are going to come up with nephrology. We have done a lot of renal transplants, and we are going to the next session is going to be with the nephrologist, Dr. Swami Alagan, Dr. Telling. So, till then, thank you.